Joining us now in the studio is Lawrence Burgee, Department Chair and Associate Professor of the Department of Information Systems at the Brown School of Leadership at Stevenson University. Professor, thanks for being with us.
It's great to be here again.
We're interested in the Obamacare website and the trouble they're having, not so much from the either healthcare or political perspective, but from the technology perspective. And you've been looking at this site since it first came online with your students.
Correct.
What did you see?
Well, I teach a class called Principles of Electronic Commerce, and in that class, the students we've been talking about since the day after rollout, and students have reported when they go out to look at the website that they're encountering many problems. Problems of just getting into the website, of being able to get any kind of quotes on prices, and just all the things that you would expect to find if you're going to buy something at a website. You can't find these things there. And so if the goal is to complete a transaction and buy something, you cannot do that yet.
They have a really difficult problem at the moment because they have this clearly buggy or website or with something dearly wrong with it, and tremendous urgency, and the whole nation looking at the thing. Where would you even start in trying to improve it?
Well, one thing is, if this is going to be something that we're going to use for decades, then I don't know why it has to be rushed. And perhaps we should put on the brakes and slow it down a little bit, because we've already spent, they budgeted $94 million. We've already spent $634 million, so we're $540 million over the original budget for this project. It's not functioning well at all. They will need to bring in a team of experts, and they are bringing in experts to try to solve the problems. But this shouldn't be rushed. It shouldn't be done overnight. And if it takes a few more months to get this in place so that it's in place for the betterment of Americans, then perhaps that's what we need to do.
Right. Well, that's the other part of the problem they have, is that people have to use it to sign up for health care. That'll take effect July 1, and many of the programs that maybe somebody is coming from have been phased out in anticipation that this was going to work. So they're under the gun as much as you can recall anybody being under the gun. You know, a website like this has, I don't know how many millions of lines of code. Is it a question of maybe there's some bugs in there, or the initial design concept was faulty?
I suspect the latter, which is, when you develop any system with technology, you usually follow a prescribed process called the systems development life cycle. And that life cycle usually says that you start with planning and decide from a functional standpoint what it is you want to do. Then you design your system and you break it into components so that different people on a project like this can build the different parts. Then you actually build the system, the actual hardware and the software, and you put all those units into place to have a functional system. Then you really need to test it, and I think that there must have been failures in the testing here, because you would test each unit, each section, which you could envision as a page of a website. Each one should be tested individually. Then you have to test the whole thing as a whole, which would be system testing. Then you can actually throw load testing at it, meaning we could simulate 100,000 hits coming to a website at a time simply by having computers simulate that flow coming into a web server. Apparently many of these things must not have been done, because all the projects I've ever been associated with in my private industry career, we did all of these things. And of course the last thing is to, after you implement it, to evaluate it. And if there are problems, you go back and fix these problems. But this may have been a systemic from the start problem. Or problems.
Part of the issue, and I'm sort of sympathetic to the people who tried to put this together, because part of it was the central database that was going to have the information on whether somebody was eligible for a subsidy. And we haven't broken out the difference between the Maryland website and the federal website here, but they both had to go to this database to find out whether somebody was going to get a discount on the insurance. And maybe that sort of thing is hard to simulate. in terms of testing it ahead of time?
Well, the more complex the system, the more difficult it is to simulate. And this is probably, from what I understand, this is the most complex system ever attempted from building a website standpoint. So, you know, Facebook was built in steps, and then things were added over the years. There's continually new features being added. Twitter was started very small and has had new features added. Walmart started very small, and they continually add new features to Walmart.com. So, but in this case, if you're starting with a massive database, you need to make sure the data can at least be simulated in the database so that you can test all the componentry. Otherwise, you're going to have failure points, and then these bugs will develop, and then nothing will work.
How does it work? What do you advise students if one of your students is lucky enough to start the next Twitter, and you're going to design the typical dorm room app or website that may turn into a home run, and you've got to make decisions on day one that won't preclude the possibility of bolting on all these components down the line. Is that the idea of open architecture? What from a design standpoint do you want to do?
Well, one thing now with open architecture, that means that when something's open, it means people are sharing all of the code. If the code is being shared, that means there are people volunteering to make the code better. So if you're using open architecture, you can build things very quickly, and you could also assured that the modules that are there have already been tested by other people that are concerned about it. So, for instance, Google Chrome was built with open architecture and guided by Google, but we knew all the pieces would work. This is very difficult with Healthcare.gov because nothing of this magnitude has ever been attempted to be able to have for 50 states, probably 50 different plans that are all coordinated under Healthcare.gov. And it's quite an undertaking.
Somebody's got what they used to call an Excedrin headache, I think.
Absolutely.
So overall trends in website functionality, where do you see the industry going? Not this specific thing, but what you talk to your students about.
Well, one of the critical things with e-commerce technologists, who are the people building this, is they have to understand the business domain in which they're working in. For instance, if you hire someone who only has a technology degree but they have never taken any business classes, you put them into a private company and they don't understand the business, meaning they don't understand the domain. So I would say the e-commerce technologists involved here would have to have some understanding of healthcare, or they won't understand at all what they're doing. They'll just be programming for the sake of programming. We actually have a process at Stevenson that all of our information systems students take called de-geeking. And in de-geeking, what we do is they keep all of their special skills with technology, but we add a layer of business acumen there. So they learn accounting, they learn marketing and management and business writing. So when they come to work for a company, not only do they have all of their technology skills intact and improved by getting their degree, but they also understand business. And I suspect that somehow there were not enough functional business analysts at Healthcare.gov to be able to understand the domain they were working in.
The de-geeking process, I guess, is something where you probably got some feedback from the private sector along the way.
Absolutely, and when I arrived at Stevenson 4 years ago, we started what we call De-Geeking 101, which was each year we're adding layers of business acumen to the students' program so that it builds up over their 4 years. So, but by the time they're seniors and they graduate, they have their technology skills. For instance, e-commerce technology, which is one of our tracks, but then they also understand the business that they're going to be working in.
Larry Burgee of the Stevenson University Department of Information Systems, thank you for coming by.
Thank you very much.
Appreciate the time.